everybody, welcome back to my channel. If you are new here, hello, thank you so much for being here. My name is Madison. Today we are on the couch, Dexter's on the floor, I have wet hair, I'm in pajamas. I just wanted to be comfortable and talk to you guys about something that's really important to me and that I deal with every day, but I don't really talk about a lot, so this one's gonna be a doozy. If you're new here, you picked a great first video because we're jumping right the fuck in. This week we are talking about how I live with chronic pain. Let's get into it. So obviously, it's Madison Wyndham video. I made a list so we stay somewhat on track. I've been dealing with this for about 3 years now, so I feel like if I just talked to a camera, it would be word vomit and there would make no sense and I would just be jumping all over the place. So I've written down some points and this video is basically going to be broken down into 4 parts. First is going to be my history with the type of chronic pain that I have, and then we're going to jump into the diagnosis of what I have. Third part's going to be about the treatment. And then the fourth part is going to be how I'm living with it now. I have always, since I can remember, had a bad back. Spoiler alert, my chronic pain is back pain. Always had a bad back. I remember going to the pediatrician in middle school and talking about having back pain, and obviously she was like, I'm a pediatrician, I don't really deal with this. I don't know, and she told me like, don't carry so much in your backpack, use your locker. And I just remember thinking, that's kind of lame, but okay, I guess. Like, nobody else my age was like really dealing with this. We're 12 years old. Who has back pain? Hello? I do. Thanks, Dad. Everything's hereditary. So yeah, middle school was really the first time, looking back, that I can remember having serious issues. I really started picking up in high school. In college, same thing, but I feel like by that point I was so numb to it all. It was my life. I had a bad back. Some days were better than others. Some days were awful and I couldn't get out of bed. But I feel like at college I had really gotten into a rhythm of it. I knew what to expect. That's kind of the lead up, and I know the lead up was very fast, but I want to really dive into the diagnosis and how I'm living now. So skipping ahead a lot, like 22 years a lot. Graduated from college, moved to Memphis, became a nurse. That obviously expedited things. You work 3 12-hour shifts a week at the minimum, and I was in orientation. I was really trying to prove myself. I was constantly running around because somebody always had something for me to look at. On my feet, 12 hours, pulling people, pushing people. I work in the neuro ICU, so a lot of people can't move themselves on their own, so it's a lot of pushing, a lot of pulling, a lot of turning, and like full grown adults. I'm not in the other NICU where it's babies. I'm in the neuro ICU. After I moved to Memphis, I don't remember it being like a flip of a switch. Like, I went from manageable to completely unmanageable, but knowing me, it was probably a gradual thing that I was just ignoring because I was new here. I wanted to prove myself. When you just start a job, you don't want to automatically be like, I think something might be wrong where I can't perform this job, especially because I'm so young. It's my first job. I want to prove myself. So there are probably signs that I just ignored and kept pushing through. But I remember when I got out on my own after orientation on night shift, that's when it really became an issue, and that developed into the chronic pain that I have now. So breaking that down, referring to my list, I have a pretty severe herniated disc. It is L5-S1, and what that means for non-medical people is your spine's made up of vertebrae and you have discs that sit in between each vertebrae. They're like a cushion. They help so bone don't grind on each other, and there are a couple of different parts of your spine, and L5-S1 is where my herniated disc sits. So you might hear other people refer to their herniated disc somewhere else, but that's where mine is. It's at the very end of the lumbar part of the spine, so L5, and then S1, which is the sacral part. So it's for visual, because I know that's confusing. It's like my very, very, very lower back, almost like upper butt, and that's where I have a very severe herniated disc. Now, I did not know this at the time because the manifestations of the symptoms And I'm a nurse and I've dealt with back pain my whole life. Nothing screamed back pain. It screamed a whole other issue. My symptoms were, I had sciatica down my right leg. And had I known it was sciatica, maybe I could have been like, this is a nerve issue, let's look at my spine. But I didn't know it was sciatica because it's not like it started at my spine and then radiated down my leg. It really just was like from my knee to my toes, only on my right side. And I thought it was something wrong with that tendon or like the leg because again, like I wasn't having any extra crazy back pain. It was just about like this sciatica was awful and I'm new. I don't know anybody in Memphis. I definitely don't know any doctors. I had to do a lot of research on my own. That year, it took me 8 months to get the diagnosis, and that year I grew up so much because I had to go to doctor's appointments by myself. I had to find doctors. I had to figure out insurance because I wasn't on my parents' insurance because I was 4 hours away from them. So back to the pain. I'm trying to play it off at first because that's what I do. I'm very stubborn and I don't like to ask for help. And again, I'm new at this job. I barely know anybody, just starting to make friends in Memphis. And it carries on like that for maybe a month. And then my mom, who's a nurse, is like, hey, you really need to fix this. This is becoming an issue. Got to the point where every time I stood up or like laid down in the bed straight, anytime I was straight, I was having the sciatica pain. And I know I'm laughing about it now, but it was the worst time of my life. With a little bit of research and talking to people, you know, the pain was my leg. So I went to an orthopedic doctor in Memphis and they were very helpful and said maybe it's tendinitis. That was the diagnosis we were running with pretty much until I got the real diagnosis, and it's extremely frustrating because tendinitis is only supposed to last for like a couple of weeks and we were running with it 7 months later. But we ran with the diagnosis of tendinitis and I tried steroid packs, I tried physical therapy. He gave me a boot to wear to really take the pressure off of that tendon. I got multiple steroid injections into my tendon, which like, don't know if anybody's thinking about that, but 10 out of 10, that hurts, especially when you have a perfectly healthy tendon and nothing's wrong with it. Kept trying everything. I mean, I was going to the doctor so much and we tried all those things. I got an MRI. I think this is the most frustrating part. I have a lot of beef with this doctor, but like, I got an MRI of my leg and he said, yeah, it's conducive with tendinitis, so we're gonna keep treating it like tendinitis. This shows it's tendinitis. And the MRI was kind of like the last step I did with that doctor. And I remember I went into work one night. I was working night shift at the time and it was really busy. I was on my feet all night. I talked to the charge nurse in the morning and I said, hey, I know I'm supposed to be back tonight, but you have to mark me off the schedule because I'm going to the emergency room right now and I will not be coming into work tonight. I was pushed to my limits and just wanted answers and just wanted some kind of relief. When you have pain pretty much every second of every day for 8 months, it really wears down on you, and that ER visit was like my breaking point. Saw a nurse practitioner. She pretty much was like, I don't know what it is, but we can do some tests at the hospital that you haven't had yet to rule out like life-threatening things. Since I had pain behind my knee, she was afraid it might be a blood clot, so I got full like hip to toe ultrasounds on both legs of blood clots. Also, be aware, I worked at this hospital, so I like knew the ultrasound technician and was just trying to avoid eye contact because I had no pants on. And they're like wheeling me around x-ray. I got x-rays done. I got a CT done. All of this was for nothing, except I have to thank her because she recommended me to another orthopedic group in Memphis. And that's when everything started to change. Fast forward a week, I have an appointment with a foot and ankle specialist because she recommended that, and she's like, you know, general orthopedist is not catching up on this. Maybe you need to go to a specialist. So went and saw the specialist. He said, we are going to do another round of steroids, and I want to get a couple of x-rays of your ankle specifically, and if that doesn't work, I'm sending you on to somebody else, because, and he told me, he was like, tendinitis doesn't last 8 months. I will do what I can to rule out that it's nothing on my part, but then I'm sending you on to somebody else, because I think he could just see the like desperation and the wear and tear on my face, on my body. I was so broken and done at that point. Well, try the steroid pack, it didn't work. Ankle checked out fine, surprise, surprise. So he sent me to, and this is so sad because it was like the day we found out something was wrong. I don't even remember what kind of specialist he sent me to. All I remember is that the specialist had a med student following him around that day. And thank goodness for med students. I know as a nurse, we're like, July 1st is rolling around, all the med students are coming in, all the residents are coming in, blah, 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 and we like give them so much shit. But thank the Lord for this med student, because I was there seeing, maybe we worked our way up and it was like a knee specialist, I don't really know. He was doing all these weird tests on me because he's a med student, and he's like, I have to go in and do assessment from A to Z, and like I have to do everything. And he had me sit on the table, and he said, I'm gonna push your big toe down, and only your big toe. He said, don't let me push it down, like pull up with your big toe. It was like, I wasn't even trying at all. He was just doing this with my big toe over and over and over again. It was just like, I don't know what this means, but it's not good. So his attending, I guess, came in and said, you know, introduced himself, was very nice, but pretty much said, this is not an orthopedic problem, and like, thanks to this med student, we've kind of figured out it's probably a neuro thing, so we're gonna refer you to a neurosurgeon. They wanted me to get an MRI done of my spine so they could have all of the information before I met with him. Got the MRI done, and he called me a couple days later and said like, hey, obviously still want you to come in, just want you to know we have found what has been causing this. And I remember I was with my friend in Dallas, and I started like sobbing, crying, because it wasn't great news, but just hearing him say, hey, we found out what's wrong with you, it had validated the past 8 months of my life. And if you're somebody that lives with chronic pain, especially chronic pain that like to a stranger, you can't tell that they're in chronic pain, you just want to be validated. And the fact that it's like, I'm not crazy, like something is wrong. 8 months, validated, and I just like broke down crying with relief and also fear, because a herniated disc is a pretty big deal, and back surgery is a really big deal, and back surgery at 22 is a big deal. So I went and met with the neurosurgeon, and you know, he basically was just like, here's what you have and here are your options. He showed me my scan, and I so desperately wish I had taken a picture, but I think I was just like in shock, and it was my first time meeting this guy, and I had like no rapport with him. So he explained that's why I have what was diagnosed as sciatica down my right leg, because of where my herniated disc is. When it herniated out, it was pushing on nerves, and it was pushing on the nerve that innervates my right leg. Makes sense? Not tendinitis. And he pretty much said I had a couple of different options, but he knew we had to do something pretty invasive. I mean, he just like laid it on the line. He's like, I don't know, I will never forget this when he said this. He said, I don't know how you're walking, let alone being an ICU bedside nurse. So he said, normally you have to do like 6 months of physical therapy, and then they try a couple of different things, and then maybe back surgery. But he said mine was so bad, and I had been dealing with it for so long. Like it was such a bad herniated disc. The scan was awful. But he pretty much said, if you want to do surgery tomorrow, I'll do it. Like, we don't have to go through all those hoops. We can go straight to surgery. And I was kind of in the mindset of, I want to nip this in the bud, like I want to be done with this. I was kind of leaning towards surgery, even though I take care of back patients all the time, and there are so many complications, and like it's really not 100% fix all the time. Thank God my mom was there. She was like, let's try a nerve block, and then if that doesn't work, maybe we can try back surgery. So I got a nerve block done, and I would say it helped me like 75% of the way, but from going from 0 to 75, it was just like the biggest difference in my life ever. So a couple months later, he cleared me to do another one, and then that took care of it completely. So that happened in May of 2017. And when I'm filming this, it's August of 2019. So I haven't had a nerve block in over 2 years, which is really exciting. I don't have any of the sciatica pain anymore, but I do still suffer from the residual back pain and my muscles around that site being weaker. Kind of transitioning into where I am now. From where I was, it's like night and day. I am a functioning human being again. Like, I literally got my life back. I'm telling you, that med student. Shout out to that med student. I still have baseline a horrible back, and it is kind of one of those things where it's like, some days I'm waiting for the other shoe to drop. Like, when is my sciatica pain gonna come back? Am I gonna have to have back surgery? That's always something that's on my radar, and that's terrifying because, again, I'm 24. I have a lot of life left to live, and I plan on doing bedside nursing for a while, and it's tough when you have a bad back, but I feel like I'm in a very manageable place with it. You know, ibuprofen and icy hot are my best friends, and some days are better than others. I will say that. I still have days where I'll wake up to work and start crying because I'm 24 and I shouldn't be dealing with this, but I am. It's annoying, but I'm very thankful it's not worse than it is. And I really just wanted to make this video. I feel like I'm gonna I don't think my channel's gonna like turn into like, hi, welcome to chronic pain, but it's very therapeutic to have an outlet for it, especially because it's like a hidden chronic pain. You can't look at me and say, you've got a herniated disc, you have back pain, even though sometimes the way I walk, because I'm so stiff, you would be able to tell. But like, hidden chronic pain is such a specific subgroup that I feel like more people suffer from than let on. Like, I found some Reddit subgroups that have been really nice and supportive, and it's just a little community that I don't know why I haven't dove into yet, because I'm 1000% a part of it. Like, I suffer from it, and it's part of my life, it's part of my everyday, and it's going to be part of my everyday for the rest of my life. So I really want to start making more videos about this topic so that I can use that to branch and reach out to people that are dealing with the same thing. Because when you have like chronic pain where somebody can't look at you and say, that's what's wrong with you, it's so easy to just hide it and push it under and say, no, like, it's fine, everything's fine. But when you find somebody that's like dealing with it, even in the slightest, like you are, it's like when that neurosurgeon calls me and said, I know what's wrong with you. It's the biggest relief, and it's understanding on a level that most people in my life don't get, and it's a great feeling. So this video was long. I'm sure it was all over the place, but that's kind of my broad story with my chronic pain. I want to make videos in the future on it more. I want to talk about like the days that I went and got my nerve blocks done and story like that, and products that I think are really helpful for me now, what helps me now, what aggravates it now, and maybe more like the mental aspect of dealing with chronic pain. So more videos on this to come. Let me know in the comments if you enjoyed this. I'm going to be hopefully posting this in like a couple of different chronic pain groups so we can get some people on board, because I want to hear from you guys. I think this is such a strong community. Like, mentally we are so strong, and I think it's great. More people need to be talking about it, so I'm definitely gonna start. But that's what I have for you guys this week. I know it was very long, so thanks for bearing with me. If you're still here, make sure to like and subscribe, follow me on all my social medias, and I will see you guys later.